The provincial government is continuing its spending spree before the upcoming election. This time, Hamilton Health Sciences is the beneficiary of $20 million. That money will redevelop aging emergency rooms at a couple of hospitals in the city.
And I'm very pleased to announce today that our government is providing over $20 million in funding to modernize Hamilton Health Sciences.
Specifically, the Hamilton General and part of the Juravinski Hospital.
This is money needed because we've seen a tremendous amount of pressure on our existing facilities. We serve over 2 million people in this catchment area. This money will go towards ending hallway health care, expediting patient recovery, and of course going to treatment at the cancer center as well.
Of that $20 million, 15 of it will be dedicated to redeveloping the emergency department at the Hamilton General Hospital.
I think the Hamilton General, especially, you know, how old that hospital is, how cramped that waiting room is. Trauma is increasing. Our catchment population for vascular and neurosurgical is increasing, so we need this desperately.
The chief of emergency medicine at Hamilton Health Sciences says none of the existing facilities were designed to manage an outbreak like we experienced with COVID.
I think that after the pandemic, we really see that we're unprepared. We're not built for these types of infections. The two emergency departments over the last 20 years have gone through SARS, they've gone through H1N1, the Ebola scare, and now 2 years of COVID.
Part of Minister Elliott's announcement was $5 million to help with the redevelopment of the Juravinski Hospital Emergency Department and new tower.
The redevelopment is planned to include a new patient tower that will significantly increase inpatient services and add over 100 new inpatient beds at the Juravinski site.
And work on the sites is expected to begin in the next few years and wrap up by 2027.